Young people, as we continue our conversations in this 15-day internship, today is a special session for you. The session is going to be taken by one and only one, Dr. Kamna Chibber, one of the best known clinical psychologists of our country, author of several books, speaker of several TEDx's, is also the head of the program for the Fortis National Mental Health Program, an expert of several years of experience. Right, we are so privileged and honored that Kamna ma'am actually gave us her 3 full hours. But as you know, I'll be somewhere around, and if you need me to, not that I can say because Kamna is standing right here, but if you feel bored and you want me to just come back and have a chat with you, just tell her that ma'am need a break. Right? Irrespective, you get your breaks every 45-50 minute mark. We'll take a short break. That'll be when the chai person will get chai for the head of the department, as we call the one and only one, Kamna Chibber, to take your session. I'll see you.
Hi, good afternoon, everyone. We are going to be talking about marital therapy today. So, I'm going to try and give you a brief introduction and also some somewhat detailed information about what the different schools of marital therapy say. How is it that people understand the various interventions that form a part of marital therapy? What are the kind of special or different approaches or aspects that one needs to be considerate towards? What is the role of a therapist? What would a typical session look like? So we will try and have a lot of these conversations. My attempt would be to try and also see if I can pick up some of your questions as they're coming while I am doing the session. Like Dr. Parekh said, we would take a couple of breaks in the middle, just probably for a few minutes, so that all of you can go freshen up, come back, and then re-engage with the whole process. Today's class or interaction does not have any associated assignment, so all of you can be relaxed about that. But just make sure that you do fill in your attendance in the attendance sheet. The same has been shared by us and is pinned on your screens, so just make sure that you do fill that in. Extremely important, because we do need to make sure that we have that data in place for our own records as well. So I'm just going to be starting the presentation for all of you. So like I said, the topic for the discussion today is on marital therapy. All of you would have been going through a lot of different interactions with my colleagues who have talked about counseling, therapy, what it involves, the different schools of therapy, what do we do in terms of psychological assessments, how do you work with individuals. And you need to understand that marital therapy also, of course, has its basis and its roots in what is done with individuals as well. It's just that some of the techniques and mechanisms do get changed or altered in order to accommodate the fact that in a marital therapy situation, you would be working with two individuals and not one person. So some of the changes do end up happening in that context, and the particular position that the therapist adopts and the way in which they conduct themselves, conduct the sessions is extremely crucial. And that is something that we would be looking at towards the latter part of the interaction. So what is marital therapy? Why is it that we are looking at it? That is, of course, the main aspect that we do need to look at. Marital therapy, in very simple terms, involves having an interaction with couples. These couples could be married to each other. They may be in a relationship with each other. They may be living with each other. They may be looking at understanding for their own selves whether they are suited to be each other's partners when they're looking at premarital counseling. And essentially, what we need to understand is that this is therapy which is conducted with two individuals who would look to have time being spent with each other and having common life goals and looking at working together in a collaborative format with each other. A lot of times when couples approach us, They come for a lot of different types of problems. Sometimes they're coming in to just build a very good, comprehensive understanding of what is going on within their relationship, how they can further build on the kind of compatibility that they have with each other, what are the ways in which they can come to support each other and ensure that they are being able to mutually move towards achieving the kind of goals that they may have for their individual selves, which also tends to strengthen the couple's relationship with each other. Concurrently, what they also may be coming with is the problems, the difficulties that they're experiencing. These difficulties could be on account of multiple different factors. It could be about, say, for instance, an individual has a different perspective about what should be done in a particular situation. So their approaches may be different, their goals may be different, and that can lead to conflicts between two individuals. And that could become the context within which a couple may approach a therapist seeking intervention and support. Sometimes they may reach out because they feel that they have significant disagreements on how are they going to be managing their finances. What is it that they need to prioritize for their relationship with each other? And that may prompt them to consider reaching out to a therapist and having an interaction or multiple interactions with them to be able to reach a way of coming to some sort of a decision or a way forward with each other across different situations of life. Because it's important to understand that two individuals will often have a different way of understanding or doing things. Their perspective could be different, their approach could be different. So coming on to a common ground and figuring out what is the best way forward becomes extremely critical. Conflicts could happen because of interference from other people. Challenges could come in because an individual within the relationship may end up having a relationship with another person as well. So there could be infidelity. Sometimes couples may reach out to you because they are having, say, sexual dissatisfaction or sexual discontent. At other times, they may find that they're struggling to, figure out what is going to be the right approach towards parenting as well. So at different stages of their lives, at different phases of where they're at, they may reach out to you for different things. And that is something which is very crucial for us to understand. So there is no one way of working on the situations that couples come with. What you need to have is an approach towards working through whatever are the challenges that they have, instead of looking at a problem having a specific route towards its resolution. So our approach matters because the problems will keep on differing. And that is what we're going to try and understand and learn through the interaction that we are having today. That what could be the approach, what are going to be the ways in which we can understand and intervene with couples. And our attempt is going to be to ensure that couples tend to develop the skills that are needed, and which will be helping them understand how to keep working through the different situations. Our idea is not to give them direct advice when they're coming to you for therapy. The idea is to be able to build an approach towards resolving situations over the long run. We need to ensure that they can work on their levels of dissatisfaction or discontentment as a way to prevent the dissolution of the relationship. Because often when couples are reaching out to you in therapy, they reach out at a point in time when every other type of an intervention may have failed. Sometimes they may have sought support from people outside. Sometimes they may have tried to intervene on problems on their own, using their own understanding or the ways in which they may have seen others resolve problems, and often they may not work for them. And that is why they may be reaching out to you to say, we have tried everything that we could understand and none of that has worked, so we need help or support or a newer perspective to be able to work on the challenges that we are experiencing. Sometimes they may reach out to you at a point in time when the conflict is extremely high. It's very heightened. Because a lot of time may have elapsed, they may have tried a lot of different approaches. The frustration and the dissatisfaction or the disappointment tends to be at a much higher level. And that can contribute towards the fact that when they're coming into couples therapy, there may be a lot of heightened emotion, which may be destabilizing the relationship. And sometimes your first aspect when they're coming in for couples therapy is to help them learn how to manage that aspect. Someone is asking in the questions that will we be talking about family counseling today? So no, we will not be talking about family counseling today. We'll only be talking about couples therapy because this is a very, very large topic. And we are going to be trying to focus on this aspect. We will talk about families in the context of how their role tends to be or what their approach can be when couples are in a state of conflict with each other, and when they're seeking intervention from the outside, what is it that the families can do in order to support a couple. So why we need marital therapy is because couples distress often tends to rise very significantly if we do not tend to intervene at the right time. It is extremely important to ensure that if this distress level is increasing consistently, that an intervention is engaged in so that couples can take care of their relationship. Not doing so often tends to propel them towards looking at separating or even divorcing from each other. In fact, if you were to look at recent data, even within India, there has been a significant rise in divorces, and it's gone up from 1 in 1,000 to about 13 in 1,000 in just about a decade's time. And these numbers may be even higher because this data is from 2017. We are in 2024, and we know that most families, most couples have gone through extremely distressful circumstances, which would have compromised their functioning, especially during the years of the pandemic. There was a lot of stress that was created during that time, and WHO had released data which talked about how depression and anxiety had increased substantially. But we also know that this was the time period where, in fact, research had shown that cases of domestic violence had also gone up. So a lot of the marital conflicts had increased during that period of time, and the repercussions of these aspects tend to continue. So it is likely that now, when we are in 2024, maybe the number of divorces could be on the rise, or at least the conflicts that couples experience could be substantially more. And this is something that most clinicians would share with you, that in their practice, they come across more people who are seeking support for their marital or their coupled relationship with their partners. And the good thing is that while we may belong to a culture where often there is hesitation to seek help, people may not necessarily be actively willing to take help from the outside. And in our culture, we know that typically families would try and intervene and support and try and help young couples work on whatever challenges that they're having. But we are seeing that there is a shift, particularly in urban areas, where more and more couples are willing to reach out and take help and support for the kind of problems they may experience within their relationship. And in fact, the reason I talk about urban areas and couples in urban areas is because we also know that there is a disproportionately higher number of separations and divorces in urban areas as compared to the rural parts of the country when we look at data as well. So what we need to understand is that when there is a lot of conflict, when there is a lot of marital distress, it leads to significant marital satisfaction, significant impact on marital satisfaction. And couples distress has a strong relationship also with how individuals tend to experience their own mental health and well-being, also in the context of their own physical self. Couples who are in the middle of significant marital stress often report a larger number of physical health related problems. They also end up experiencing sometimes an impact on their overall mental health. A lot of people report a rise in experiences of difficult emotions. Some people talk about a lot of anxiety. A lot of people mention that they experience more low moods. Some people experience disturbances in their sleep, in their appetite. Maintaining relationships can be difficult. Focusing, concentrating, maintaining their attention can be hard. A lot of these different aspects do tend to come in and impact individuals and their functioning. And this can have a significant effect on couples, on individuals, and makes it even more necessary that if there is distress, which is within an individual's environment, and if it is in the form of what is going on in their relationship with each other, with their partner, it must be addressed, because that is an aspect which would compromise their functioning across all domains of their life. So this is why it is extremely important that we must keep looking at what is happening within the context of the relationship that a person has with their partner, and if there are ways to make it more more satisfying, less conflictual, more effective for them in helping them achieve their personal goals, aligning with their value systems, aligning with the kind of life they would like to have for their own selves. In fact, we do know that this distress, because it does get mediated on account of what are the social relationships. It also has a reciprocal relationship with uh, how an individual may engage on the outside with other people and outside with their work. And there is also a chance that it could not just lead to poorer health outcomes, but people are known to have an increase in suicidal ideation as well. We need to understand that, of course, this is not for every couple or every individual in a couple who may be experiencing distress. But there are researchers which have found that these aspects also tend to get heightened, which makes it very important that we do take account of the distress that happens in marriages, and we provide interventions in the right way, in the most effective and efficacious manners to couples if they do reach us. Marital therapy. Early on, when it emerged, in fact, a lot of people used to believe that it may not be the most effective approach. And in fact, trying to gather evidence about the effectiveness of the approach was always challenging, because situations that couples go through can keep on varying and changing. A lot of times it becomes hard to be able to evaluate whether the relationship is overall in a better space or not. So what becomes important is to be able to understand that uh, we we are not taking an approach where you're looking at how was a situation resolved specifically. What is more important is to keep on looking at that when you engage in marital therapy interventions, it is the overall approach that needs to get changed for the couple so that they are able to take care of their relationship in a better way. We can't remove discord, we can't remove disconnect within the relationship entirely. There will always be moments where couples will have conflicts with each other. There will often be situations where they would struggle to engage with each other and interact with each other. There will be moments when they may have not just conflicts and not just disconnect, but also may need some sort of may find themselves working towards different goals. But can they come together to still have a common approach, recognizing the value of what they have with each other, is what becomes crucial. And that can only happen if they have an overall good approach to their marital life. In fact, research has consistently pointed out that if couples take marital therapy when they are experiencing great distress in their relationship, they are likely to have better outcomes uh, as compared to couples who may not take marital therapy. And this kind of a change is seen with at least 80% of distressed couples who would not take marital therapy. And in fact, couples who did take marital therapy did much better in their relationship with their partners. And this is a research which was in 2003, where they have done a meta-analysis of different studies. Marital therapies have been evaluated, and there are lots of different schools of thought, and we would be looking at them in the subsequent slides as well. Some of the common schools of thought which have a lot of evidence base associated with them are cognitive behavioral therapies, integrative couples therapies, and in fact, one of the schools of thought which is based on a lot of empirical evidence is Gottman's method, which is something which we would be discussing in some of the later slides, where we will be looking at specific schools of marital therapy. What do we use as a principle to understand how effective couples therapy is something which is very critical for us to understand as well. What is crucial or critical to the effectiveness of couples therapy is that um, is there an objective conceptualization of the problems that is being provided by the therapist to the couples or not? A lot of times when couples are viewing their problems, they have their own individualized way of looking at them, and this is something which would be, of course, having its own subjective elements, because they are individually placed in that situation. They would have their own biases, their own emotional experience, their own ways in which they are understanding or perceiving situations, and that would certainly be contributing to the ways in which they are understanding what is going on in their relationship. So it is important that when a marital therapist or when the therapist is working with a couple, that they provide an objective understanding of the problems, so that it is not a situation where one partner or the other partner is feeling blamed, but instead they're able to build an understanding of what are the patterns that are there, which could be fueling the kind of conflict that is being seen between the two partners. What needs to be focused on is how do we modify those particular patterns, which are often driven by a lot of emotion. That emotion gets attached not just in the first instance, but over a period of time as couples go through multiple different experiences with each other. Going through a lot of these experiences, when they have a lot of when they start having strong reactions to situations because of the kind of emotions situations evoke for them, it can lead to a situation where the reactions are very strong. That can lead to a shutdown. It can lead to a situation where there is aggression. It could lead to a situation where there is, a person is being either aggressive or completely withdrawing on account of the aggression, or it may lead to a situation where there is a complete shutdown of communication from both the sides as well. So modifying the way in which we are understanding what is happening within the equation for the couple becomes extremely important, so that they can step away from the emotion but start responding to the situation based on the objective conceptualization of the problems that has been shared by the therapist. So how this tends to work forward is that you start eliciting what are the ways in which one partner is understanding or perceiving what is happening in the equation. A lot of times, what happens is that a person may not recognize that they are forming a lot of assumptions about what is going on within the equation that is there between them and their partner. So, person A says something to person B. Person B automatically assumes that it is coming from a certain context. They don't seek clarification, they don't ask a question, and it leads to a strengthening of their own belief system about person A. So, a lot of times, what happens is that people are not asking the right questions to each other, which is strengthening their assumptions, leading to a situation where there are a lot of beliefs which are getting created about partners without really having enough evidence to support that. And that is something that we need to look at working on, because this implicit talk which is happening within an individual, which is driven by emotion, which is driven by the beliefs that are getting formed because we are not seeking clarification, sharing our experience, discussing what is going on, tends to fuel the ways in which the couple are engaging with each other. which can be conflictual, which could involve a withdrawal or an avoidance pattern. It could involve a lot of aggression. It could involve a partner seeking solace or comfort outside. All of these often link to how individuals are thinking about each other or about the relationship. And another aspect which is extremely important is to start looking at improving the kind of conversations or communication that the couples are having with each other. The communication that couples have with each other often can become very transactional, and that can be extremely detrimental to the relationship, because what keeps a couple together is not the transaction of what needs to be done, what are the chores that have to be taken care of, what are the roles or responsibilities, but the kind of emotional availability, the psychological support that one tends to have. And sometimes, because one has gone into a space of being transactional, the communication can often become either very bland, sometimes it can also become extremely negative. Because there may be beliefs that have been formed about the partner, the response that one has towards them can come from a space of a lot of negativity. And there can be taunts, there can be negative, sharp, negative comments, which could keep on impacting the kind of interaction and the relationship that the couple have. So fostering communication, which is extremely productive, becomes really, really essential. And we have Dr. Parekh behind us who wants to take something from
My
you.
water.
So that's extremely important for us to understand. How do we ensure that productive communication is happening, and that becomes a focal area for therapists when they're working with couples? And the idea is to keep emphasizing on the strengths and the positive behaviors. When you are in an adversarial situation with a partner, you don't notice the good that is happening. Automatically, everything that is bad, everything that is negative keeps getting highlighted to the mind. Your mind starts believing that there is nothing good in the relationship. So, pointing out to the couple that there are goods, there are positives, there are things which are worth considering as being meaningful becomes extremely critical. And at the same time, helping the couple recognize that the two of them together bring together a certain strength. They have certain pieces which could be considered as large aspects which would help them function effectively in every situation of their life, becomes extremely critical. So these are some aspects that any approach towards couples therapy needs to keep in mind or provide a framework for, to be able to ensure that the couple's work that is done by a therapist is effective and gets taken care of in a manner that the relationship gets strengthened. So I'm going to take a couple of the questions and comments that I hear. So someone has asked that if we take a scenario where two people have completely different personalities, are opposite to each other, and may not be compatible, what do you do then? See, the intent of the couple really matters. There are couples who may come from very, very different lived experiences. They may have extremely different ways in which they may function. But if they have a common value system, they're able to create shared, meaningful ways in which they want to construct their life. And they're able to also construct a way of communication which is effective, which is mindful, which is sensitive. And they have a way of coming towards common goals to build a life on which they can agree, then the relationship can still work. Even if there is an incompatibility, it is something that can be effectively taken care of if the couple is willing to work on it, which means that they have to be mutually in a space where they're willing to reconsider the ways in which they approach their relationship. They need to be willing to reconsider the kind of rigidities with which they may be thinking or engaging in their equation with their partner. So that becomes an extremely important component which also needs to be kept in mind. Do past fights between couples with the child have witnessed can have a negative aftermath on the child? Fights between couples, as far as possible, should be kept private, because yes, when a child observes an interaction which is a negative one or a violent one or an aggressive one, it would leave an impression. It leads to the creation of anxieties. It can lead to the creation of belief systems about what couple relationships can be like. It can fuel their ideas of how or what communication needs to be. Even if there are situations where a couple may end up engaging in fights in front of a children, if in front of a child or their children, if they take an approach where they talk about it with the child later on, then they can take care of that belief system. It is not necessary that children cannot be protected, or that a child seeing one fight or a few fights will necessarily be negatively impacted for life. It is about what is the perspective that was also shared with the child afterwards, to help them process and understand what went on, and to be able to manage their own emotional experience of having seen what they did see. So that is something which is very critical. Um, so if we are looking to change communication, it would require the couple to change. What if they are not willing to change? It's important to understand that when a couple is coming to us for marital intervention, we need to look at understanding that they are here because they're seeking change, most likely. And that is something that you establish at the very beginning of your intervention, to understand from them why are they there, what are the goals that they have for the intervention, what is it that has prompted them to reach out to you as a marital therapist, what do they seek for their relationship. If there is an individual who is not motivated for the therapy, then your first step needs to be to build the motivation for change. Without the motivation for change, any intervention cannot be effective. So it is extremely important to focus on that piece, whether you do that in a couple setting or you need to request them to probably work on their individual thought process. That is a call that you would need to take individually. Should a couple take therapy before getting married in order to have better relationship with each other? Not necessarily. I don't think that we can have an all or none way of functioning when it comes to looking at therapy or what would work best for couples. It's important to understand that there would be individuals who would be able to, and who do navigate their relationship extremely effectively and very well, and have a good understanding, communication with each other, and overall their relationship with each other would be great, even if they've not gone through any sort of a couples therapy or a marital therapy or premarital therapy. This is not a must or a necessity for someone. It is only when you start noticing that there are certain areas where you're struggling to communicate with your partner or build the right kind of understanding, or it is leading to conflicts or problems within your relationship, that yes, seeking that support could be helpful, or there have been any adverse experiences in the relationship which are compromising your functioning that need to be taken care of. Okay, so we will go on to the next slides and take a step forward and come back to some of the questions later on. It's important to also understand how has marital therapy really developed over time, because marital therapy in itself has gone through a lot of different phases in how it has emerged. Its first phase was in the early 1900s, between 1930 to 63, in which it was called the atheoretical marriage counseling formation phase. Essentially, this was the phase in which marital therapy wasn't necessarily being provided in the form that it exists today. It was being provided more as an intervention for couples from experts within the community elders, people who were in, say, the clergy in the West, or in positions of authority, such as teachers, educators, who would give a more value-based understanding of what is happening in a relationship. They would give solutions towards what should be done in the here and now, and their focus was more on helping couples develop a way of coexisting, of building a way of being together with each other through an understanding of what are the different marital roles and what are the goals of marital life. So this was not a time within the growth of marital therapy where the intervention was being provided by a specific therapist per se. This was more by the elders within the community, something which we still continue to see within India as well, where a lot of times when there is a conflict between couples, it is the family elders who may intervene, or elders within the neighborhood who may intervene and try and provide support to couples. And this kind of therapy is not intense the way we may provide therapy to couples in our clinical, settings. This kind of therapy is very, very specific and precise. It was something which would have one particular goal or end in mind. You're trying to resolve one particular situation, you're trying to give them a way forward. So extremely directive and not really following any principles or models. Like I said, it was based on more an understanding of morals and values and ethics and what is required within society. And it was later on that marital therapy actually started getting formalized into a proper school of thought. And this was the second phase of marital therapy, which lasted from 1930 to 1966. So it's almost parallel to the first phase, which was the theoretical phase, within which therapy was being provided by elders or people in respectable positions within community. And this was called the psychoanalytic experimentation phase. This was the time when exponents of psychoanalysis started intervening with couples, and they started looking at understanding how is it that an individual's distress and an individual's experience of and a mental health related illness could be mediated on account of the marital relationship that they have with their partner. So they started then inviting partners of the individuals that they were working with in their practice into the clinical setting to try and see what is it that can be done and how is it that that relationship can be taken care of. They in fact called it interlocking neurosis at that time, and it was only the decline of psychoanalysis towards the end of the 60s which led to the emergence of the third phase of the development of marital therapy interventions, which was called the family therapy incorporation phase. So this is when actually a lot of research and understanding about families, how families function, what are the various modalities through which family intervention can be done, started influencing the way in which couples and their relationship was looked at. And it was during this point in time that there were four very influential individuals who contributed to the growth of the field of family therapy, which was eventually leading to its alignment also with marital therapy. So the first was Don Jackson, who was talking about concepts like what is the role of communication. How is it that families tend to try and maintain a balance within their environment? How is it that they try to maintain a balance by looking at what goes on the outside, what goes on the inside, the different roles that individuals play, so as to be able to maintain a certain balance of equations within the entire family constellation. So there are rules, there are roles, there are communications which lead to a certain way of functioning within the family system. And there are often trade-offs which happen within the family systems to be able to ensure that there is stability within the families. And this understanding acted as a very significant contributor towards the growth of systemic or interactional components within couples therapy as well, and was associated with how the individuals see themselves and how they become a part of the couple and also the family subsystem. The other contributor was Virginia Satir, who was talking about self-expression, self-actualization, and relational authenticity. And her emphasis was on how the individual creates space for themselves within the marital relationship. How do you, as an individual, keep maintaining your perspective, keep sharing your experiences, keep finding ways to be able to realize your goals, and how do you maintain your ability to be open, authentic, genuine within your relationship? Because often situations can become such, relationships can become such that individuals may not always feel that they can be authentic and genuine, and they may develop their own anxious thoughts or fears or patterns through which they struggle to communicate more fully what they would want, need, or desire within the relationship. So these were some important concepts that Virginia Satir was talking about. Murray Bowen was at the same time emphasizing the influence of multi-generational and transgenerational matters. And in fact, this is an extremely important concept when you look at working with couples in India, because there are multiple generations who may live together even now, if not always in the urban areas, but semi-urban areas, rural areas, you will see that there are multiple generations who do live together. We have a joint family system which is still pretty much large within our society. And that is something that does lead to the creation of hierarchies, of rules, of ways of functioning, which can sometimes be difficult for couples to navigate, especially when you have a new individual entering into the family system that has been pre-existing. So he talked about how triangulation operates within couples, within the marital framework, within families. Then you had Jay Haley, who was talking about power and control. And he talked about how all relationships which are dyadic would have an element of power within them. And that often individuals, their responses, their interactions tend to be directed towards balancing that power, towards having control so that their individual needs are also met. And he talked about that the absence of a clear hierarchical structure and of rigid boundaries and the presence of rigid boundaries can prevent flexibility for individuals to get integrated fully within the family system. And what happens in transgenerational household or multi-generational households is that sometimes the hierarchies and the boundaries can be very rigid. And the work within couples therapy may involve how do you loosen those boundaries? How do you create some amount of permeability so that the roles can become a little more diffuse in a way that it does not disrupt the functioning of the family overall, and yet the couple and the new individual entering the family on both the sides is accommodated and feels comfortable within the new family setting as well. He also engaged in an approach which was directed towards solving problems instead of only looking at particular patterns which were about, instead of just looking at the patterns, but actually actively trying to solve for the problems which were leading to the creation of those patterns between the couples. This leads us to the fourth and the last phase of marital therapy, which is the phase in which, in fact, marital therapy is at currently. We'll just talk about this phase, then we'll take a 5-minute break because we are at the 45-minute mark. But I want to finish this part for all of us so that we can take 5 minutes. So in this particular phase currently, Marital therapy is in the process of refinement, extension, diversification, and integration. So, four different pieces which are coming together for marital therapy. Um, when we are talking about refinement, it is about how the systems and processes of the different approaches are seeing significant growth and the emergence of different schools of thought within couples therapy, which are leading to the development of specific techniques, specific strategies, specific ways of helping couples navigate their relational challenges. So, for instance, we have integrated behavioral couple therapy, which has come about, and we'll talk about this particular school of thought slightly later, where the emphasis is placed on how do you build acceptance and tolerance. So, the idea is not only to look at changes in terms of what are your beliefs, what are your ways of thinking, how do you express emotion, or how do you communicate, but also looking at how do you build acceptance of the fact that you are in a certain relationship or you are with a partner who has certain characteristics. How do you build tolerance for the pieces which may not be the most comfortable for you? So, this process emphasized or brings together different the growth within different theoretical enterprises, which is leading to the emergence of more refined schools of marital therapy intervention. There is also an extension which is happening of marital therapy interventions in its current phase, where you're looking at aspects such as self regulation within individuals. And we're looking at how clinical conditions may be moderated or modulated or even influence the relationship and the couple dynamic. So, how is it that there is a two-way interaction between these processes is something which is being looked at as well. And of course, this is a phase in which there is a lot of growth. There are new schools of thought which have emerged. There is emotion focused couples therapy, there is Gottman's method. There are a lot of other newer schools of thought which are also emerging, which have a lot of evidence base which is associated with it. And there is also a re-emergence of approaches which were previously which have over time become less popular or less common, such as object relation schools. School of thought has started re-emerging, and there is an incorporation of newer models using integrative and pluralistic methodologies as well. So, in its current phase, marital therapy is now extending its influence, and it looks at how mental health related illnesses mediate and affect couples, and how changes within the couple dynamic can affect the physical and mental well being of the individuals as well. There is a lot of diversification which is happening because we're trying to also integrate perspectives from diverse schools such as feminism, looking at multiculturalism, looking at understanding how cultural factors tend to mediate and impact marital therapy, marital work, postmodernism. So there are a lot of different elements that are coming in to couples therapy, and you're seeing them integrated into newer approaches. What we will do in the following section is to talk about models of marital therapy. We'll pick on about 10 schools of thought. I will be giving you a brief orientation to these different schools of thought so that you understand how diverse and how dynamic this space is. And what we'll do for now is we'll take a 5-minute break. So we're at 3:49, almost 50 right now. We'll join back at 3:55, and we will take this conversation further then. So I am just going to mute myself, and I will also stop my camera, and I will see you all in at 3:55. So please take a break, and I will see you soon. Hello, everyone. I am back. So, like I said, we would be talking about the different models of marital therapy. But before we go on to that, I'm going to try and take on some more of your questions so that we stay on top of that as well. So, um, in India, would we work with a couple who is in a different state of their relationship? They're not married to each other. Well, for us, any two people who approach us for therapy, we are in a profession which is supposed to be and which is non judgmental, unbiased. As a therapist, that's the position that you're taught. So, whoever is the couple who approaches you for therapy, you would work with them and you would help them determine what or how they need to take care of their equation or their relationship with each other. Um, if a therapist has witnessed their parents discord and fight, should the therapist do couples therapy? Yes. A therapist is a human being like any other individual and would be going through their own experiences in their life. That does not mean that they should not be working with either individuals or with couples. It is important to understand that as a therapist, you should try and ensure that you have processed your own experiences, that they do not create biases or stereotypes in your own mind. If you are able to identify that there are certain ways in which those experiences may interfere in the effectiveness with which you can function in providing therapy, then you need to try and work on those. So, taking supervision, having mentors or advisors, looking at peer interactions can be extremely helpful in this regard. So, being aware of what your experiences may have been and how they may impact you or impede your functioning becomes critical. Um, uh, mm, It is often that post-marriage couples tend to hide things from each other. Why do you think that happens? There can be a lot of reasons why people may hide things. It's about what is the intent behind hiding. Sometimes hiding happens not as a conscious action, but sometimes for couples or for individuals, they may just simply forget about things. They may not remember to mention it. When there is an active attempt to hide, it is important for the individual to look towards identifying what would the reason be. Are they, concerned about how their partner would respond? Do they feel that their action was not okay in itself? Are they making a value-based judgment on their own action? If so, then what was it that made them act in a certain way for in the first instance itself? Um, Sometimes they may feel that their partner may not have the emotional or mental bandwidth to really look at the concern that they're having or the situation that they may want to share or discuss. Sometimes they may feel that the partner is not available or there is a lack of interest in what they're sharing. So those could be various reasons, and there could be many others as well. When you are working with a couple where you notice that there is a tendency to not share things fully, then as a therapist, you should try and understand from the couple, for both the individuals, what could those aspects be and where that is coming from, so that you can direct your interventions towards taking care of some of those aspects. And if you're saying what if the couple is hiding something from the therapist, um, if they're hiding something from you and you've not been able to identify it, then there's nothing that you can do about it because you would not be aware of it. But if you've been able to surmise or understand that there is something that they're actively avoidant of sharing or discussing with you, then it may be important to one, reflect yourself to try and understand that is there something in your approach which is making the couple apprehensive. Two, it would be helpful to also try and look at understanding from the couple directly what it could be that is happening and what is it that is preventing them from sharing, and try to address that to the best that you can. Um, okay, we are going to look at the models, and because a lot of these are application based questions, so we will be reaching that part of the interaction as well where I will pick up more of these. So when we're looking at the models of marital therapy, there are 12 primary models, and each framework looks at and conceptualizes couples, their experiences, their relationships differently, and they uphold the applicability and effectiveness of a different set of techniques, which are based and which is forming the basis of how each of the interventions is looked at. So the different aspects that you would be looking at when you are evaluating the different models would be: what are the processes that are important for the functioning of the couples? How do they view healthy and dysfunctional marriages, and how do they believe individuals tend to relate to each other? So these are the three aspects on which most of these schools of thought would differ from each other. There is a different emphasis on the kind of processes that they consider are important. There is a difference in which they look at how healthy or dysfunctional a marriage is, and there would be a difference in how they believe that individuals are relating to each other. So the first school of thought that we will pick up is CBCT, or Cognitive Behavior Couple Therapy. As the name indicates, it is based on cognitive therapy, and it is the confluence of behavioral couple therapy, cognitive therapy, and research on information processing. And it looks at the interplay that exists between cognitions, behaviors, and emotional responses. So the interaction that you would have had with my colleague Tara, which was on CBT, she would have talked to you about how CBT looks at the functioning of thoughts, emotions, behaviors, and how they tend to influence and impact individuals. So the same conceptualization is also utilized by CBCT, or Cognitive Behavior Couple Therapy, as well. And in this, the goals that they have created for couples therapy include: how do you help couples to start re-looking at the ways in which they are thinking about or understanding each other, and how they are looking at and understanding uh, where the distress is coming from. Are there any unrealistic expectations? Are there any biases? Are there any attributions which could be faulty attributions? Are there belief systems or assumptions which are underlying the belief systems which could be impacting the functioning of the couple? So, your idea during this particular type of intervention is to try and understand where is it that the dysfunctionality may be emerging from in the way that the couples think about each other and the relationship. So you also work towards help the couples build on their communication skills. In fact, someone had asked a question where they asked that, how is sharing possible? Sharing is possible in an environment where you feel that there is no bias and judgment. Or even if you know that the other person would have their own perspective about things, there is still an understanding that if you share a different perspective, it will not get rejected. It is not about the other person embracing or accepting a partner's way of thinking. It's about having space to have those two different belief systems or ways of functioning to coexist. So that is only the space where sharing can happen, where you know that your sharing will not get rejected or dismissed, or you will not be put down or told that you are not good enough or you don't think in the best way. So there is no attribution which is happening towards who you are as a person. So those are the spaces in which communication skills can be built. And this is one of the goals of CBCT. Now you're also working upon the problems that couples have in their interactions. So do they interrupt each other? Do they often not listen to each other? Do they struggle to say things in a way that would not offend the partner? Do they struggle to be able to say things in a way which is devoid of, say, taunts or passive aggressive forms of communicating? So, how do you work upon the interactional challenges that the couples are having becomes another goal of CBCT. And in this particular type of intervention, you don't use any formal specific assessment tools But yes, you do a case formulation just the way that it is done in CBT, where you develop an understanding of what are the thoughts, feelings, responses, what are the underlying assumptions and belief systems which are influencing the ways in which the couple are interacting with each other and leading to the kind of dynamic that they share with each other. So what you're trying to do is you understand and modify the cognitive, emotional, and environmental factors which are affecting the couple's way of functioning with each other. And you are looking at utilizing cognitive and behavioral interventions for doing this. So you will be focusing on aspects such as communication training, problem solving, conflict resolution, restructuring the ways in which the thought process is, identifying the kind of dysfunctional or irrational ways of thinking that may be there, identifying what are the assumptions, helping elicit emotions more fully, expressing finding ways of expressing affection, improving sexual functioning, and also looking at building acceptance and tolerance of differences. The second approach that is there is integrative behavioral couples therapy, which was developed by Jacobson and Christensen. This was something I was talking about previously as well when we were looking at what are the different refinements which are happening within the field of marital therapy. And this is the space in which a lot of growth has been happening in marital therapy. It is a modified framework which tends to rely on contingency shaped behavior, along with building acceptance of things which are unsolvable or unchangeable, which means that the model lays a lot of emphasis for couples to be able to build the understanding that not everything can get solved. There will always be situations where problems would persist despite the best intent, despite the efforts that individuals may exert within their relationship with their partners. And it becomes critically important to understand that your acceptance of that which is not going to be solvable or that which is not going to be which will be unchangeable is extremely important. So you have to learn how to shift your attention from the problem to what is it that can be done, how much can be done, where something cannot be done. You have to come to an acceptance of it, a resolution of it internally, and find an alternative way of being able to take care of your distress so that it does not impact the overall relationship. So out of the 100 things which are possible, you may not be able to solve for, say, 2, 5, 10. So how do you build that acceptance and tolerate the fact that it would not be a perfect piece that is going to get aligned in exactly the way that you would have envisioned for it to be, becomes a critical component of how this intervention framework works. So they try to look at developing an assessment of how the couples how they understand how distressed they are, what is their level of commitment to the relationship, which would directly impact the effort that they're willing to put in towards making things better. And it would determine the intent and the ability to be able to let go or build acceptance and tolerance as well. How well do they understand what are the issues that make them disagree, their individual strengths, and how the therapeutic approaches can help them. This school too involves developing a case formulation, which looks at what is the predominant theme that characterizes the couple's way of interacting or engaging with each other. And is there any sort of a polarization process? So are they getting pulled towards any one end of the spectrum as far as their functioning is concerned? And how do they come to understand the mutual trap? So their communication and way of engaging with each other creates a trap which they keep falling in repeatedly. So there is a patterned way in which they're engaging and interacting with each other. Understanding that becomes extremely important so that that can be interrupted. That disruption of the pattern, of the trap, of the polarization is critical to how effective the intervention would be. When we look at what are the specific strategies which underlie this particular approach, then there are three types of strategies. Strategies which are directed towards change, because we are seeing that there are some, in fact, a majority of things which can change within the relationship if the two individuals decide mutually that yes, we would want to bring about a change. So for that, you rely on techniques or strategies that focus on using behavioral exchange techniques. You look at changes in the area of communication. You look at enhancing the problem solving approaches that couples have. Then you have a set of strategies which is looking towards building acceptance of what is, which emphasizes bringing the couple together in having a better understanding of their emotional or each other's emotional experience of being in the situation. So instead of focusing on what is happening to me, how can I come to understand after I have shared what is happening to me, what is happening with my partner? So I enter a conversation with what is happening to me. I exit from that conversation with what was happening with my partner. So, how do we come to empathically join to each other through the process of discussing the differences, the different issues that have been there happening recently, by developing an understanding of what can be the different triggers, the positive aspects that can be a focal area of the different difficult situations. So we look at building the acceptance to this kind of a process. And then you have a third set of strategies which involves building tolerance, which is an extremely critical aspect, which involves looking at enhancing what are the different positive aspects that relate to the person's way of functioning or being, understanding those pieces and not allowing yourself to get focused only on the negative or the bad that is happening. Often couples find themselves narrowly stuck on the bad. So shifting that attention towards what could be the positive even when there is enough negative becomes important. How do you practice uh, the how do you practice utilizing the negative behaviors between the sessions to be able to help the couple to shift towards more positive ways of functioning or responding to each other becomes another approach that is utilized. And you talk about the negative behavior between sessions as well to build greater tolerance, so that you understand that yes, sometimes that negative behavior will happen, and you try and engage more in self-soothing strategies, caring for your own self, reminding your own self that you can take control of parts of the problem for your own self, instead of focusing on what my partner is doing or not doing, which is troubling me. So looking at the tolerance, we then come to the third school of thought. I know this may feel a little heavy since there are so many schools of thought, but just stay with me. Each of them makes a lot of valid points, which in fact tend to inform marital therapy work for a lot of couples. Having this understanding of these schools is also very critical in determining for your own self that if you plan to pursue working with couples, what is the approach that may resonate with you. And we're only trying to look at some basic principles, some basic understanding of these approaches. The idea is not to fully entrench you in what exactly each approach involves, but to just have a flavor of what each may look like broadly, so that you have a better understanding of what can be done or how it can be done. And if in the future you want to read more, then you know what are the different approaches that you could consider looking at. So now we come to the second set of approaches, which is the humanistic existential approaches, and the first one within that school. And these approaches are the more newer versions of therapy with couples. They have extensive evidence base associated with them, both the schools of thought which are encompassed within this approach, which is humanistic existential. The first one we're looking at is emotionally focused couple therapy, which was developed by Johnson and Greenberg. They have done seminal work, lot of research within this area, and they integrate a lot of different aspects and focus on helping a therapist who is adopting this approach to look at building a collaborative alliance with the couple, because they look at that as central to ensuring that the couple can utilize the therapy or the therapeutic space as a secure base to be able to build greater attunement. It is emotionally focused, so it focuses on building a lot more attunement, enhancing the attachment within the relationship that the couple share with each other. They view emotions as central to how couples are associated with each other, the way they are attached to each other, and they believe that there can be distress in the way emotions are expressed, emotions are experienced, emotions are understood, emotional functioning happens between couples, which is what is potentially leading to the kind of conflict that they're having because they're not able to respond adequately to each other. So they look at the enactment of attachment needs, which may link to uh, how the individual may have grown up, what their individual specific needs are, and the fact that these needs may not be getting met within the relationship, which create problems between the couple, and keep maintaining them. And these cycles where a need is expressed, it is unmet, leads to distress, need to be broken, which is what the focus is. So the change is only possible by enhancing or improving the emotional experience that the couple have within the context of their relationship. And you create the framework for that within the therapeutic setting through the collaborative alliance that you're creating with the couple, where it is becoming a secure base for the couple to be able to share their experiences. So, couples who are committed to change and towards continuing with each other are the only ones for whom this approach is built. They very clearly state that in this approach, that unless the couple is determined to look at continuing their relationship, this approach would not be effective because um, it requires the individuals to be very vulnerable, and vulnerability can only come in if we want to ensure that we are able to function well with each other and want to restore the relationship. So the tasks of the EFT therapist include, of course, you need to build the right kind of relationship so that there is safety within the therapeutic setting and the partners can share comfortably what their experiences are. You build on the experiences, on the experiential understanding of what the relationship is like for the partners, and you to try to develop an understanding of the emotions that they experience in their interactions, and you're looking to help them restructure their ways of expression, communication, their emotional understanding so that they have a better dynamic. So, this therapeutic intervention involves 3 stages. The first of which is you do an assessment and you help them de escalate. Like I had mentioned earlier on, that often when the couples are reaching you, they're in a state of heightened conflict. If the conflict is very large, they will not be able to bring about, or they will not be able to adopt an approach that can help them or change. So some you will have to focus on creating that stable space for them each other. So you are looking to build an alliance and you do an assessment to understand what is happening with the couple. This is not necessarily a formal assessment where you may use specific scales or questionnaires. They don't necessarily advocate for that. But you build an alliance and you do an assessment, which is essentially an understanding of what is going on. You identify and understand the cycle of their patterns of interactions and where are the emotional needs getting ruptured, not met, disrupted. and you uncover what are the primary emotions and attachment needs that each individual has. So you keep reframing and putting the problem in front of the couple so that you can elicit an understanding of what is going on. Why is the partner affected? What is happening to them on the inside to lead to the kind of distress that is evident on the outside? So you use strategies like validation, you reflect, you keep tracking the cycle that you're seeing so that you can get enough evidence base to say that yes, this is the pattern that they have. So the pattern could be something like one partner says something, the other partner responds in a gruff manner that gets interpreted as um, there is an aggressive response. The aggression makes the person withdraw. That withdrawal leads to irritation. That irritation leads to further aggression, and it leads to a situation where the partner has a breakdown. So there could be this kind of a cycle which is happening. So you keep tracking it to see, is it happening across multiple different situations? If that is the case, it informs you about what needs to be done to be able to de-escalate the situation. You respond in a manner that leads to an evocation of the emotion, and you try to join empathetically to the experience of both the partners. So you communicate through empathy your understanding, and you also suggest tentatively what do you think could be happening. So there is empathetic conjecture as well, which is being utilized. Sometimes you may need to look at utilizing techniques like reframing so that you can help enhance the kind of understanding that the couple has, because the language that they may be using, one partner may be using, may not always be fully understood by the other partner. So you may sometimes need to adopt the position of a translator, so to say, who is helping you, who's helping the two partners interpret what may be required or what is being shared in a way that is understandable to each of them. And sometimes you engage in enactments as well, where you allow them to replay and share in elaboration the conversations the way they happen in a real context, so that you can see the cycle which I was talking about previously, where I was talking about tracking the cycle. So you can see how that cycle plays out to be able to help them understand what position they are each adopting, and you can help them move around. Without that understanding, that movement may not be possible. The second stage,
Can I just give you your tea and then go?
Thank
I've been standing here very patiently.
and that is Dr. Parekh.
Chai person, chai person.
So we had the first stage where we are looking at assessing, we are looking at de-escalating the conflict, and then we come to the second stage. The reason I'm explaining this approach a little more elaborately is because, like I said, this is one of the more prominent approaches being used in today's time besides the cognitive behavioral approaches. And it has a particular system, lots of evidence base, so it will help you understand this a little better. And it informs a lot of marital therapy work for a lot of people. So it may help to know this a little better. And the second stage would be restructuring the bond. So if all the information that you developed or that you were able to procure in the first stage is what you utilize to work in the second stage, where you start restructuring the bonds, where you start changing the interactions. Because once you've identified the cycles, you've understood the emotions, you understand how the couple are engaging with each other, you help them start restructuring their ways of communicating and sharing their needs. So you first help them own what their emotional experiences and attachment needs are by sharing what you have observed. You help them also then build an acceptance of what the other person is experiencing by pointing out to them in through the utilization of multiple understandings that you have gained in the first stage, what it may be like for the other person. And you facilitate the expression of needs and wants, because a lot of times when couples are communicating with each other, they may share what is not there, but they will not necessarily say, what do I want? So the partner may end up trying out option A, B, C, D, E, F, and give up before they reach to G, which is what the partner may have wanted. So if you are able to facilitate the sharing of needs early enough, then the other partner does not have to go through trying out approach A, B, C, D, E, F, and would straight away be able to go to G. So helping couples share their needs, share their wants is something which is helpful to both the individuals. So the typical strategies would be you respond evocatively, you use empathic conjectures, you heighten the emotions so that there is a clearer expression of needs, you reframe, you help them in zooming out of the narrow situation to look at the larger patterns, the larger needs, the larger goals, and you look at again enactments to restructure the interactions where you now, instead of just listening to what goes on in different situations, you also interrupt and you give suggestions on what could have been done differently, or you invite them to share what they think they could have done differently. And then there is the final stage of this intervention, which is consolidating and integrating the work that has been done, in which you build new solutions to the old problems and you consolidate the newer understandings and reinforce what knowledge they have acquired about each other, what understanding they have of each other's needs, their emotional experiences, and how they can utilize them to better relate to and engage with each other. In this, again, you're using validation, evocative responding, reframing, and enactments. So this is the first school within the humanistic existential approaches to marital therapy. This next one is Gottman's method. Again, a very large, prominent school, which was developed by Drs. John and Julie Gottman. Extremely prominent. You may come across this phrase, sound marital house. Which is a concept that was developed by them. Essentially, they did and have been doing, and in fact continue to do, extensive research with couples, and they have built the model bottom up. So instead of coming up with a theory and then testing it out with individuals, they started doing interactions and research with individuals and have then built up their theory. So they have taken a bottom-up approach towards building this model of therapy, which makes it an extremely unique and interesting way in which they have approached, and their understandings have shaped the marital therapy domain in a very, very significant way. And like I said, they continue to do a lot of extensive work in this area, and their students continue to do a lot of work in this area as well. They use a proper formal assessment process. There is a Gottman relationship checkup overview form, in addition to a proper oral history, which is taken within the session. So there is a structure and a format that is followed, and which is advocated for to ensure that you have all data points in place before you start intervening with the couple. And you focus on, of course, building an alliance with the couple. You engage them and you give them a copy of the Sound Marital House, which is what I was talking about, which basically talks about how do you build love maps. So how do you build ways of connecting with each other? They talk about sharing fondness, expressing admiration, giving those little nuggets of reinforcement to each other on a regular basis. That particular model of Sound Marital House talks about turning towards each other. Often when there is a problem, couples turn away. They don't necessarily acknowledge the good. They won't necessarily come towards each other, and they ignore even the good that is happening. They talk about how do you maintain a positive perspective even when everything may not be the best. They talk about managing conflict. It talks about making life dreams come true. It talks about creating shared meaning. So these are the different aspects that it does cover. Now the goals of the intervention here, their first goal is to bring down the negative interactional cycle. Ensure that the conflicts tend to reduce, because unless the conflicts will come down, you will not be able to engage in any form of repair. If there is constant destabilizing within the relationship, there is no way to be able to ensure that you can build up good things within the equation. And you need to look at developing an understanding of what is unsolvable, which is something that even the previous approach advocates for. Emotional focused therapy also talks about how do you understand that which is unsolvable. It's extremely important so that you can start focusing on what can actually be repaired. And you are able to start looking at what are the instances which were regrettable, how do you let go of them. They also mention that there are 4 negative horsemen of communication. And these include things like dismissiveness, stonewalling. They look at how do you bring down these aspects and build and come to a compromise. You learn how to communicate with each other and you engage in soothing yourself if there is distress in the relationship. Your second goal is that when you've started stabilizing the equation, you've brought down the negative, you need to also build up the positive. They advocate for the understanding that simply reducing the negative does not mean that the relationship is looked at positively by the couple. So lowering of negatives is not equivalent to a positive. It just brings you to a neutral ground. If you want to make it positive, you need to do positive. So you need to upregulate the positive emotions even when you're in conflicts. So you need to keep your attention directed towards what is good. And their third goal is to build positive affect between the partners, positive emotions with the partners during the periods of time when there is no or little conflict. So we have to optimally utilize the time when things are better. That is when actually a lot of times couples tend to become complacent because they feel things are good and they may not really actively work on their relationship till they hit another major roadblock and there are problems, and that leads to a complete dip in their equation, and then you almost feel like you're back to square one. So it's very important to keep emphasizing to couples that even when you feel you're in a relatively okay space, you need to keep working on maintaining the positivity in the relationship. So you have to focus on emotional connection during everyday moments, looking at daily stress reducing conversations, and if there are difficult conversations, you need to be able to try and close them. You build affection, you build response, you have and you focus on having good physical intimacy, and you process the failed bids for emotional connection during these times so that they do not become larger issues which impact the quality of the relationship overall. The fourth goal is to bridge the meta emotion mismatches. Two individuals may look at the same situation differently, and even though their emotional experience of the same of the situation may be the same, their thought about it could be different. So you have to look at bridge those gaps and create shared meanings, shared values, build rituals of connection, and support life's goals, support roles that each have. Like I said, that this is one of the most prominent schools of marital therapy, which has a very large body of evidence associated with it. It is often, in fact, being utilized as a preventive paradigm as well. They have a lot of structured workshops which are conducted for couples in group settings as well. It does include homework and couple needs that emphasizes couples' needs, and it does involve couples following these very diligently to ensure that they are in a good space with each other. Within the Indian context, there is some debate around whether homework is effective or not within the context of couples therapy, and there is some research which points to the fact that often when there is homework that is shared with couples, they may not necessarily engage with it, and it may not be the most effective way of working with them. So this part is something which is a little debatable in the Indian context, not otherwise for the approach, because of course the approach has found a lot of efficacy with the existing paradigm. And I will talk about why this is important for us to understand later on as well. Then we have a third set of two schools, which we will be talking about. Overall, we are today talking about 10 different schools. We've already talked about 4. We have another 6 to go. The remaining 6 we'll be talking about very briefly. So don't worry, we will not be going into again too many details, just an overview. It may feel very theoretical, but like I shared, that the idea is to ensure that you have a basic understanding of these approaches, and we'll reach the more application related aspects in a short while. So we have the object relations couples therapy approach, which is within the psychodynamic transgenerational approaches, which was utilized and expanded upon by Dix in 1967. Like I had shared that psychoanalysis's involvement in couples therapy had gone down when there was the emergence of the family therapy movement. And then later on, 67 onwards, again, object relation school started coming up into the picture in the later period, and this talks about the fit that exists between partners and their unconscious complementariness. So there is a joint personality that couples form, is what they advocate for, and it is that which needs to be considered when you're looking at how good their relationship can be with each other. They interact, or couples interact and connect with each other, not just in terms of what they actually say to each other, but even at an unconscious level about how they experience their needs to be, how they express their emotions, the ways in which their ways of responding and understanding have been shaped by their own early experiences. And this leads to an unconscious connect between couples where they may resonate with each other's approaches. And this is often at the core of whether they're able to stay in love with each other or not, because it determines their understanding of each other. They talk about that there is a significant role that is shared of shared cultural values and individual values as well, not just the unconscious connect that the two would have, because the larger the fabric of shared value systems that the couple would have, the more connected they can be with each other, because their understanding would be based on similar experiences, is what is hypothesized, or similar understanding of experiences as well. So marriages which are unhealthy or malfunctional often involve a fit that would reinforce previous defenses of repression, which do not allow for the healthy expression of needs and desires and experiences, and keep creating conflicts for couples. And he relied on the concept of projective identification, which was given by Klein, which is a defense mechanism, which is often considered in psychoanalysis as a very, very significant aspect. The goals include how do you understand mutual projective and introjective identification work between couples, and helping them to rework and improve their capacity to hold experiences, to hold emotions, and how they experience each other to be, so they can be empathetic towards each other, and they can provide for their needs and take care of their attachments, and ensure that developmentally they keep progressing in a movement towards growing individually and as a couple. They do focus on building their capacity for empathy, for intimacy, and for sexuality, which are considered to be at the core of good relational experiences. And these are often shaped through unconscious communication that happens between the couples. Um, that is something which is extremely critical. How well the couple is able to hold the emotional experiences for each other tends to be at the center of how the communication is for them. They also look at enabling the process of individuation and differentiation for the two people who are in the couple. And if needed, they would encourage the couples to also consider individual therapy, so they can grow within their own spaces as well and not keep relying on each other for the same all the time. They do help the couple to take upon themselves the task of the developmental stage that they are currently at, so that they can keep moving forward in a healthy manner. They look at setting the frame for therapy, listening to the unconscious, creating psychological space, using the therapist self through the mechanisms of transference and countertransference, developing negative capability, working on, like I said, transference and countertransference, interpreting defenses, anxieties, understanding intimacy, looking at working with the inner objects, with fantasy, and also working within dreams. The second school within this particular approach or system of approaches is the transgenerational couple therapy, or TG as it is called, which includes of a lot of work that has happened within the natural systems theory, symbolic experiential theory, contextual theory, and some aspects of object relationship theory as well. It uses principles of intergenerational family processes, which are seen to be long term and slow to change because there are hierarchical structures, power dynamics, roles which get attributed, and these are not something which can be easily shifted. So, understanding these are extremely important, and these are believed to be unconsciously transmitted from one generation to the next, and often shape the kind of expectations that get placed upon couples and how they are required to function. And this can often create distress between the couple because they may not have explicitly discussed some of these pieces before they engage in a relationship. So TG approaches focus on building resilience between couples instead of looking at symptom reduction. And they examine the issues which relate to personal authority instead of focusing on just what the family needs or family of origin needs, and looking at how that can be balanced for the individual, for the family. They look at things like sexual dysfunction, what are the unconscious marriage contracts, which means essentially the expectations that each individual came into the marriage with, what are the different unresolved issues and conflicts, the gender and power dynamics, if there is any violence in the relationship. They also work in the area of late life reconciliation. In fact, for a lot of couples therapists, you may find them sharing about how, in India as well, how a lot of times couples approach them for therapy after having been married for 2, 3, 4 decades as well. Because in the early years, they would have probably not looked at what they needed within the relational equation. Their focus was more on families, on children. And as a result, many years go by, and when they're at that later stage of life where they no longer have those roles and responsibilities and have time for their own selves, experiences of the past re-emerge. So looking at late life reconciliation towards the choices that you made individually, the life that you've had together, building a better one in the future becomes a rather important aspect. They also work with multicultural marriages, something which is emerging in varying urban areas and needs to be focused on. So these assume that a healthy marriage involves a flow of empathy, and each individual is committed to the mutual good of the couples. There are clear rules and mutuality with which one needs to function and be able to share fantasies, hopes, expectations. And differentiation is a key process because it's about helping the individual also recognize and build their own self and not just look at how they're functioning within the familial framework. And problems in marriages can emerge and create dysfunctionality on account of negative attributions, triangulations, triangles, entitlement, and different conflicts. Within India, it is extremely important when we utilize some of these models to understand that cultural aspect is extremely strong, and a lot of these models are developed in the West. Again, I'll be talking about this later on as well. But from this perspective here, in the context of this particular model, we talked about how differentiation is one critical process that they look at, whereas in India, given culturally how we emphasize families, family values, the joint family system, support from elders and within the community, one has to be extremely prudent about how the differentiation process is looked at, because there needs to be a balance between where one is looking at the differentiation to occur and how much individuation, and maintaining boundaries which are somewhat semi-diffuse and not fully open. That is extremely critical for couples and how they function with their families within the Indian context. The next set of approaches are within the social constructionist framework. We have narrative couple therapy. If some of you have read about narrative therapy, couples work within this particular framework is very similar. And this focuses on generating experiences and not just getting information from the couples. They're encouraged to bring their best in selves into the discussions of their relationships. And instead of looking at what is healthy and functional or dysfunctional or certain fixed or rigid traits and characteristics, we have to look at also the dynamic that the couple have with each other. And the focus is on considering newer directions, building newer stories, creating a narrative that allows the couple to be in a healthy and happier space with each other. You keep on looking at asking questions to bring out what are the gaps in the narratives that they have constructed and the contradictions that exist there, which often happens with most individuals, that there would be a larger emphasis on certain pieces and not adequate emphasis on other pieces. And so that is the space which gets utilized by the couple therapist to point out the gaps. And you utilize techniques such as deconstructive listening and deconstructive questioning, where you're breaking down the entire narrative and trying to understand in detail what was going on and how things were understood. You look at the technique of externalizing conversation. You name the problem and the project so that you can put it into a particular frame. You focus on creating unique outcomes, not what is necessarily traditionally expected or societally expected, and bring into focus what is actually relevant to the couple who is there in front of you. You look at talking about the absent, but that which is implicit, a lot of assumptions which are there, and expectations which are unsaid or unshared. And you look at developing a history of the present and extending it into the future, instead of allowing the past to actually continue to proliferate into the present and extending into the future. You do a lot of telling and witnessing and retelling and witnessing, and you help them build a relational identity. And you document and circulate new stories for each other. The other approach within this frame is solution-focused couple therapy. This is the third last approach. We have another 2 more to go, and then we will take another break. So bear with me for another 10 minutes, and then we go on to the more application-based part. In the solution-focused therapy, which was developed by Shazer and colleagues, they had looked at 3 rules. If it ain't broke, don't fix it. Once you know what works, do more of it. And if it doesn't work, don't do it again, do something different. Simple principles that they advocate for within the approach. And this is usually conducted in a team-based format. So it's not one individual therapist who's working with the couple. There are multiple people who are working with them on different parts of the therapeutic intervention. And they believe that the goals need to be simple, small, understandable for the clients. They need to be described in very specific, concrete terms so that they are achievable within the context of the couple's life. And it should involve or be perceived by the couples as it being about their work and described at the start of the treatment. The idea is not to provide answers, but to direct focus towards what is right and what are the ways of being right, instead of the complaints around what is construed to be wrong within the situations of the relationship. So you keep shifting the focus towards what is right, how can you be right? Don't keep talking only about what is wrong, because that gets you stuck and does not allow you to move forward. So the first session involves eliciting what are the different problems, where you can ask a miracle question and ask them if they could change, and if there was a miracle, how or what would their current life look like. And you rate on a scale within the context of a particular problem as to how important this is. And there is usually a break mid-session, during which the other members of the team are also consulted with by the primary therapist, which is followed by regrouping with the couple and first giving the compliments to the individuals and then handing out of the homework to the partners about what they need to do. The typical flow of the session involves assessing who is coming to the session, as in who is how or what is the role that is being acquired by the two individuals of the couple in the session. Is this the visitor? Is it a customer? Is it a complainant? And using that to construct the complaint, understand the exceptions, and building hypothetical solutions. In subsequent sessions, a check is done to evaluate if the sessions are better, and a check is carried out to understand the task performance. And clients are encouraged to generalize to see what is working so that they can develop rules for their own selves. Okay, last two, systemic approaches, which are actually very relevant for the Indian cultural context, given that families and family systems are extremely large for us, and there are often a lot of different systems at play which need to be modulated. The first school of thought is the brief strategic couples therapy, which is based on creating interruptions to the ironic processes or patterns that get set between couples. You emphasize on how problems persist and not why they originated or where they originated. So they're very focused on the here and now and what needs to be done. And the customership principle is the key, which emphasizes that the therapists work with the persons who are most concerned with the problem. So whoever the problem relates to most, you focus on them, and you preserve maneuverability, which is designed to maximize the possibilities for therapeutic influence. Excuse me. Therapists do not directly get involved or push for specific solutions. Typical strategies would involve define the complaint in a specific behavioral format, set the minimum goals for change, investigate solutions, formulate ironic problem solution loops, specify what less of the same would look like, understand their preferred views of themselves, the problem, and each other, use these views to frame questions for less of the same solution behavior, and nurturing and solidifying incipient change. And the last approach, structural couples therapy in the systemic approaches, developed by Mnuchin in USA, often very, very strongly talked about. They focus on assessing what is the structure of the couple's subsystem and emphasize that the couple is one of the subsystems in the larger familial system. And there can be multiple subsystems within the families which influence each other. So one partner may have a subsystem with their parents, they may have subsystems with the individual parents, with their siblings, similarly for the other partner, and then there would be subsystems within a particular unit. So there are multiple subsystems which are functioning, and there are often power, generational, and gender-related dynamics at play. And each of these subsystems have their own boundaries. Some of them are diffuse, some of them are rigid, some of them are semi-permeable. And it is the extremes of the boundaries which need to be modified to be able to ensure there is enough movement that can happen for the couples. They focus on the experience of the here and now, behavior of the partner, and help the couple build and have new relational experiences. They focus on aspects like enmeshment, disengagement, power, alignment, coalitions, and how do the couple come together in a better way to be able to have a stronger, better relationship. They use techniques of joining, boundary making, enactments again, and restructuring and reframing. And after you have a comprehensive understanding of how the subsystem of the couple operate, you help them start changing different parts of that subsystem to be able to help them realize their own goals. And if there are differences in what their individual goals are, first you help them align on a specific goal to be able to change that, and then work on the boundaries that exist within their different subsystems. Okay, so before we head towards the next 2-3 sections and we start taking all your questions, let's take a 5-minute break. It's 4:57. I will see you at 503. Okay, so we will then talk about what does a typical marital therapy session look like, what are the special issues, different concerns, and how do we address those. So I will see you in about 5 minutes, and I am going to now stop my camera and mute myself. You can all take a break, come back in 5 minutes. We'll see you then. Okay, we are back and we will start with the remaining of the presentation. So what would a typical marital therapy session look like? Um, Usually, in most sessions, you would mostly start with a joint session. The idea is to try and develop a very robust understanding of what is happening between the couple. What is it that they are approaching you for? How do they each see the problem as? And how is it that, or what are the different ways in which they have tried to resolve the challenges that they've been experiencing? Um, this is usually followed by either an individual interaction which happens with each of the partners in the same session, or by an individual session each with the two people. The idea of these individual interactions is only to ensure that if there were certain parts that they were not able to share in the joint session, that they should be able to talk about it more freely so that you have a more fuller, robust understanding. Also, it is during these individual sessions that sometimes you may choose to also do an assessment to be able to understand what are the different patterns within their communication, their adjustment, satisfaction, or any clinical aspects that may be required. Uh, this is something that is often done within the couples therapy. What this assessment also does is that when you are looking towards terminating sessions, you can do a reassessment to also evaluate what was the effectiveness of your intervention. After that, you start doing joint sessions. In the first joint session that happens after these individual sessions, it's to share the understanding that the therapist has developed. And there's also a discussion of the results of the assessment. Now, depending upon what assessment measures were used, how this was done, some parts of it you may discuss together, some parts of it you may discuss individually also. Whatever is pertinent to the couples together is what you would discuss within the joint interaction. And this forms the basis of also formulating what are the goals for for the intervention that you're going to be doing with the couples. You can have continued informal or formal assessments to keep evaluating the progress of the therapy. And like I said, if you use particular scales or questionnaires to evaluate where the couple are at across different types of variables that may be affecting their relationship, you may use the same measures at the end of the intervention as well to be able to assess how effective the intervention was. Most of the sessions that you would be doing with the couples should be predominantly done in a joint format. This is extremely crucial because having that balance and ensuring that the couple is informed about what work is being done together is extremely crucial. If you have too many individual sessions, you can develop a bias. Sometimes the two individuals may feel that you are not sharing more fully what is going on. There can be misunderstandings, miscommunications which can occur. So ideally in couple therapy, most sessions should be done in a joint format. There are numerous assessment measures which are available. This is a list of some of the ones which are used by therapists. Gottman's relationship checkup form, marital adjustment scale by Locke and Wallace, Snyder marital satisfaction inventory, the Kansas marital satisfaction scale. There is a Hindi version available of this. Couple satisfaction index by Funk and Roque, Fincham and Linfield's positive and negative quality in marriage scale, Spanier's dyadic adjustment scale, Hendricks relationship assessment scale, the marital quality scale, which has been developed by NIMHANS. Some of you may wonder that, what if there is a problem between the couple, but the partner is not willing to come? There are certain models which have been formulated in which you don't do conjoint couples therapy, but you may do individual therapy, where the focus may be on trying to alter the couple dynamic through work with one individual. And research shows that working with even one individual can be a more effective approach than doing no intervention at all. So if there are individuals who approach you and say that there is a problem within the relationship, I don't know what to do, my partner is unwilling to come, you can still do work with them and through them try and intervene or change the way they may be engaging in the patterns within the relationship so that the dynamic starts shifting, and that could be also a helpful approach. There are some things which we must keep in mind when we are working with couples. The timing of when couples are seeking support or intervention is extremely significant, because something has happened which has propelled them to seek out the intervention at that time. What was it that was happening then? What has led to the emergence of now being the crucial period when an intervention needs to be happened is what leads to is what is extremely crucial, and a question that therapists need to ask within their practice. While importance is given to a developmental perspective on how individuals within a couple dynamic function, clinical parsimony and effectiveness are extremely important. What this means is that when you're working with a couple, you need to be structured, you need to be systematic and organized in how you're conducting therapy. Therapy is not indefinite or too long term when you're working with couples. It is not like how it is done when you are working with an individual. Couples therapy is very time limited. It's something which needs to be done within a specific frame and needs to be parsimonious. A lot of times, in fact, when couples therapists report that there are very high dropout rates within marital therapy for them, that happens on account of the fact that there are lots of logistical challenges towards engaging with couples therapy for couples at times. So, for instance, coordinating the times, making sure both partners are available, issues such as finances, issues such as travel, maintaining the motivation. It's not just about navigating these aspects with one person. Now you have two people. So it does complicate things. So your focus within couples work is often towards ensuring that whatever strategies and techniques you are employing need to be effective, need to be parsimonious, need to be structured. You are working within for achieving specific goals. It is not going to be an indefinite process. And if you realize that there could be certain individual clinical concerns which are emerging, then you may want to refer them for individual therapy. Mostly, couples therapists should not and do not do individual therapy with the individuals who they are working with within the couple framework. If there is a person you're working with individually and they want you to meet their partner, if it is a one-off interaction, that's different. But if they say that I want you to do couples therapy, then for couples work, you need to refer them elsewhere. That is always better, because there should not be any biases on account of the previous understanding that you have. Typically, interventions are engaged in much early within marital therapy. In contrast, in individual therapy, you may take a few sessions to reach an understanding of who the person is, where they come from, what are the unconscious processes that may be at play, what are their underlying belief systems, assumptions. Depending upon what model of therapy you follow, you may take longer to engage in interventions, but in couples therapy, the intervention starts from the very first session. So you are engaging in constant frames of being able to utilize certain strategies, techniques to ensure that the couple's relationship can improve, their levels of satisfaction and engagement can be enhanced. The focus of therapy is very clear, and it is derived from an understanding that is generated from the couples during the intake itself, which could be during both the joint and the individual sessions. So every session that you're having is of great value and needs to be optimally utilized as a marital therapist. There are some special concerns which we must be aware of. In fact, someone had asked also, what if there is an extramarital relationship? Should that be a relationship which should be worked on, or a question to that effect? See, it is important to understand that as a therapist, when you are looking to engage with couples, you cannot and should not be coming in with your own judgments and biases. So if there is an affair, it is not your judgment which is important. It is about what is the couple seeking. If they are looking to find a way to consolidate and reintegrate their relationship, and they would like to focus on rebuilding what they had with each other, then it is your ethical duty to be able to dispense that particular approach which would work best for them. If you so feel that you may not be able to on account of whatever concerns may emerge for you, then it may be best to share with them that they should seek intervention elsewhere. Because as therapists, it is important to ensure that you do not compromise on the kind of work that you are doing. And if you are certain that you may not be able to do your best, then it is better to step out of that situation than try to continue to engage in it. Extramarital relationships can occur, they do occur. And when couples come in and seek intervention, if they are looking to repair the relationship, your focus must be there. In such situations, often there is a reiteration and constant seeking of more information. And often in that situation, you have to keep on redirecting the couples towards what is their goal. Because answering all of those questions can be answered once, twice, thrice, but there is no new information which is going to come out on the nth time. So at some point, you have to keep working towards shifting them from the position of seeking information to working on the dynamic, to understanding what led to the situation, and figuring out could there be ways of making this work which are realistic, and does the change actually happen or cannot happen, and how would the change scenario look like. Another complicating factor could be if there is an individual clinical diagnosis which is impacting the relationship. In that situation, your role as a therapist becomes helping both the partners understand what can they expect in terms of uh, the effects of of the current clinical condition on their relationship. How is it that they can mediate it? What are the ways in which they can start realigning their ways of functioning, recognizing if there are any belief systems which are contributing towards them experiencing or feeling or thinking that something is happening which is not okay or it is being done with intent, clarifying those aspects and enabling couples to realize that an individual would not be mentally unwell by choice. Their mental ill health is on account of a biopsychosocial understanding of how an illness occurs. So being able to clarify that, encouraging them to ask questions of their individual therapist or psychiatrist to better understand what the clinical diagnosis is, what the progress of treatment would be, and how recovery would look like, and continuing to work on the quality of their relationship and how they can be more effective with each other in supporting each other and communicating with each other. Someone had asked questions about the impact that difficult marriages may have on children. And the fact is that yes, children would get impacted, they would get affected. Protecting them is extremely important. As a therapist, if you're working with a couple whose dynamic is rather challenging for each other, you may need to also constantly keep highlighting to them what effects it may be having on those around them, whether it is children, whether it is also elderly parents or other individuals within the household, and how is it that they can take care of that aspect. If you feel and realize or recognize that the child is getting impacted to a point where they should also get some support or some space, then encouraging the parents to consider that can be helpful. Sometimes that support can come through their own school's counselors. Sometimes it may require meeting other experts. The experts could be a child psychologist, it could be an art-based therapist, it could be a clinical psychologist, it could be anyone. That would depend upon the individual situation that is there in front of you. In cases where couples are getting a divorce, it is important to, one, not personalize it to your own self, and to be able to understand that if you have been able to provide whatever was the best intervention, then that was something that you did well enough. But at the same time, it is important to take a reflective approach to understand that could your therapeutic intervention have been done differently? Was there a more effective or efficacious approach? What are the techniques or strategies that you may need to build into your own arsenal, so to say? How do you ensure that the therapy that you do conduct is more effectively received by couples? Concurrently, if the couple is working with you and chooses to continue working with you even through this process of divorce to ensure that things go forward smoothly, and if they have children, that the impact is the least on them, then your role becomes even more pertinent. And it is important to keep maintaining the same balance of how you would encourage two people who have a dyadic equation with each other to keep focused on the goals that they need to achieve and focusing on the values by which they would need to or want to live. Extended family involvement in India, in particular, becomes extremely pertinent concern because often there is, I wouldn't always say interference, but sometimes even out of concern, extra involvement by families, which can be impacting the individuals, and it can be helpful to sometimes, not sometimes, to in fact, it is rather necessary, in fact, to keep on engaging in conversations about boundaries and working towards building a mutual understanding of what could be the best boundaries for the couple with each other and for their relational unit. This is a process which takes time. One has to be very patient. These are conversations about boundaries which need to come in much later on after the couple has first stabilized their relationship with each other, understood how they want to function, have developed a better way of communicating and understanding, and then you shift towards the extended family or external people's involvement, because sometimes when you're having conversations about these topics, it can lead to an escalation or a conflagration of the conflict. So you may need to go back to de-escalating, so to say, the conflictual situation and then coming back to this topic. So you have to keep on going back and forth a little bit. Ethical considerations. Who is the client or the patient? In this, it is the couple together. It is not about developing a position from which you're trying to judge what their equation with each other is. You have to look at what would work best for the couple together as a unit and how is it that they can achieve their goals together. Who makes the decisions? The couples should be making the decisions. You can give them guidelines, you can give them suggestions. Ideally, what works best would be to allow them to arrive at decisions. But in India, given our cultural context, often therapists, like other medical professionals, like other professionals, in fact, are often seen at this position of almost a guru, and they see themselves as shishyas. So this guru shishya aspect, which was outlined by Nikki in 1973, continues to exist even today. And sometimes couples may seek that kind of hand holding, and you may need to give some amount of direction. But usually, the decision making needs to be of the couple so that they can own it and they can live by it, because those choices are going to impact the rest of their lives. Confidentiality is a must. It is something which is extremely important. In this context, it becomes extremely important to ensure that most conversations are happening in a joint session, so that there is openness which is there and trust which keeps getting built, and there is tolerance for difficult conversations as well. If families reach out to you, it is your responsibility and ethical duty to not respond without the permission of the couple. And in fact, even in that scenario, the couple should be present if any interaction needs to be had with anyone else relating to them. And ideally, no conversation should be happening on the outside. We have to maintain cultural sensitivity. Most models of marital therapy intervention are related to the West. There is little research which has happened in India, a lot more which is now happening. So you should keep your eyes out. You should keep your eyes open for more understanding of research which is happening within the Indian context. Because you can't ad hoc pick up an approach and apply it to the Indian context. You need to take a slightly different approach. Certain things would work, certain things would not work. There are power dynamics, there are hierarchies, there are boundaries which can be, and systems which operate. There are expectations. We do have the traditional gender norms which do continue to function despite the changes in society. So some of these pieces do tend to contradict the way in which the models of intervention, which are based on the West, advocate for interventions to be conducted. So you need to understand those. And the therapist's self, your own values, your own goals, your own culture, you need to have a greater understanding of that so that you can ensure that that does not impinge upon the work that you're doing with the couple and they remain the priority in doing what they need to do. Your own competence, your own training is critical. You have to keep on ensuring that you don't just keep reading, but also actually properly train in marital therapy. Um, there are very few programs which provide that training currently, including the programs which are there for counselors and for clinical psychologists. So, additional training is often required, and it is a must because this is one space where, unlike individual therapy, where enough is not taught in colleges, in universities, unless you're doing a specialized program. So, you should be careful on how you conduct the same. And supervision is a must. I believe that peer supervision is something which is really helpful. So discussing cases, which means surrounding yourself by other professionals, is extremely important, and that is something which is very critical to how people tend to function and do well and grow. Learning is a process that never stops. It's extremely important to keep yourself informed and to keep educating yourself, and that also happens through your interactions with peers. So I would keep reinforcing that. So the therapist's role in marital therapy is to help the couples build an understanding of the problem, don't take decisions, encourage them to make their own choices and keep moving towards change, but also to accept that what would be difficult to change. There is a balance between collaboration, guidance, and directiveness, which the couples need to involve and integrate. Be aware of the cultural stereotypes, gender biases, family processes, because they do inform your therapeutic intervention and they do lead to the requirement that modifications may need to be made to the way in which therapies are being conducted here. And this is something which is again attested to by a lot of research, by lots of clinicians and researchers. And like I said, the models that we use are developed in the West. The cultural context is different. So be mindful of how you are applying things, when you are applying them and utilizing them, and why is it that you're doing it, so that you can ensure that the effectiveness of your intervention is enhanced, given the nature of the problems and the couple's dynamic that is there in front of you. So your flexibility is important. Do not have a very deterministic view of the outcome of the intervention. You should not be the one insisting on values. The couples should be the ones who should be coming up with what is valuable to them. Do not push the couples for change unless there is readiness from within them. They may need to be motivated, they may need time. Sometimes they may want to take a break and a breather. That's okay. It is better to discuss those pieces within therapy. Do not be an advocate for change, but instead be the therapist, where you are the receptor of the client, of the patients, of the couple's experiences, and you help them better understand their own experiences and work towards achieving their own goals and reformulating their dynamic with each other. It's important to be mindful of what stereotypes and biases you may bring in to the therapeutic intervention. Be careful of not asserting your own beliefs which relate to either boundaries or about how families should function, or how you may view extramarital affairs in your communication with the couples. Like I said, that if you feel you are ill-equipped to handle a situation, or you may have strong views on a certain situation, then you can always step back and step away. It is important to ensure that you don't keep pushing one partner to make greater strides. There needs to be a balance between how you're working. Even if you feel and know or see that one partner requires to demonstrate more change, the other partner will need to provide also a greater support system. So there is always a balance that can be reached between the two, only if you are aware of what you are doing in the intervention. And not discussing the rationale for the approach and the structuring of the intervention is a potential pitfall which can lead to disengagement from the couples, because if they don't understand what you're doing and why you're doing it, they may not stay engaged to the process because it may not make sense to them. Okay, that's some of our social media handles. You can use these for tips on mental health. Stay connected with us. And that's our helpline. And now I will take some of your questions. Going to, sorry, going to exit the presentation. Okay, is there an age limit for couples taking therapy? Do adolescents in a relationship also take therapy? There is no age limit to couples taking therapy. Adolescents often do not reach out for relationship therapy. They may reach out for individual support for their own self. Um, yes, today's session does not have an assignment. I had shared this in the beginning as well, sharing it now as well. There is no assignment today. You are just here to attend, but just ensure that the attendance is signed. Please take care of that. Um, uh, mm, mm, mm. Um, Someone asked for explaining one therapy which is most used in couple therapy. Like I shared, a lot of the humanistic existential therapy models, emotion focused therapy, Gottman's method, are often used very prominently, as is CBCT, which is cognitive behavioral couple therapy, and integrative behavioral couple therapy. Should all couples take therapy? Not necessarily, unless there are significant challenges. Also, we have a very large shortage of experts. If every couple would start taking therapy if they don't need it, it would not be feasible for that to happen in any case. Um, so, unless there is a situation through which individuals' own efforts or efforts through interventions or support by friends and family don't work, it's not necessary for couples to reach out for formal therapy. Um, should a single person willing to enter a romantic relationship take couples therapy? No, not needed. Couples therapy is to work on specific challenges that individuals may experience with regard to their partner or the relationship that they share with their partner. If someone wants to seek an understanding of how they can be in a relationship and what are the ways in which they can uh, be more effective in a relationship, they can seek individual therapy for that, but not couples therapy. Why do people have an affair when they love their current partner? Um, there are lots of reasons why infidelity occurs in relationships. It's not, there could be a lot of challenges that couples are having within their relationship with each other. Often they're not able to adequately communicate. Sometimes their sexual relationship is not satisfactory. Sometimes, despite communicating to their partners that they are feeling unsure of what is going on, they may not be able to reach a resolution to the problems. Sometimes they do it in an impulse. A lot of times people claim that they did not think through about the consequences of what this could lead to. So there are multiple reasons why people come up with that people come up with when they talk about why is it that they had an affair. But at the end of the day, I feel that a lot of times what an affair also suggests is that something went amiss either for the individual or for the couple, and which is what needs to be understood, identified and understood, that what was happening at an individual level that the person made that choice, and what was happening within their couple relationship that prevented them from understanding the impact of the choice that they made. Could there have been things which could have been done differently on both fronts, and what would have ensure that they could prevent something like this from happening, especially if they intend to continue being in their relationship. Then focusing on these pieces is important so that they can strengthen their equation and their own individual selves to make better choices. Mm. Uh, do couple therapists also have sessions with partners individually? Very, very less, and I would say that it is best to have as less individual sessions as possible, only because, like I had mentioned, we don't want biases to come in. We don't want there to be a perception that there is a better understanding of one person's perspective and not the others. We also don't want the feeling that there is a problem with one person with whom more individual sessions are happening, or we don't want a misunderstanding or a feeling that the therapist is communicating one thing to one partner and another thing to the other partner, because how things are understood can often be different by individuals. So it is best to do as many sessions together as is possible. If there is need for individual work, I would ideally recommend referring the partner to another therapist. Um, um, okay, trying to look for more questions. So, when there is an issue around intimacy, couples therapists would often focus on enabling, developing an understanding of what has been the challenge that they're experiencing. There are specific models of working on intimacy issues within couples. If there are a set of clinical problems which are leading to a challenge on the intimacy part, then you need to resolve that. So, for instance, if a partner has vaginismus, there is a problem of, say, an erectile dysfunction, or if there is any medical complication that the two have, because of which there is a challenge in either lubrication for the female, or erection for the male, or ejaculation for the male, then it is important to also address these aspects first. And then when you're working with it therapeutically, you may be using Johnson's technique as well. Masters and Johnsons have suggested a full therapeutic approach to help build sexual intimacy and take care of sexual activity. And you can follow that approach. Marital therapy is somewhat, it overlaps. Sexual therapy is a part of marital therapy, but marital therapy is a broader frame in which you are looking at the couple's relationship with each other and different aspects of that relationship. And sex is only one small component of the same. So, which is why we've not really focused on what sexual therapy is done. Is couples therapy always dyadic, or individual therapy also has a role to play? Individual therapy can have a role to play if there is an individual related problem, and if in the couple both the partners are not willing for intervention, then then one partner can also engage with an individual therapist to understand what they can do better with their with regard to their marital relationship. Do marital therapists need thorough knowledge and understanding about what the law states about divorces, domestic abuse, etc.? It's always better to be informed and to understand these aspects. It will only help you and support you in the work that you do. Um, What if there are different expectations regarding the outcomes when one partner does not want to continue and the other one wants to? Um, I think what is extremely important is, and I had mentioned this during the conversation as well, in one of the earlier slides when I was talking about it, that both partners need to be committed towards change or towards bettering the relationship. If any one of the partners is not fully invested in the process, it may usually not work very well. Because change cannot happen on account of only one partner putting in the efforts. It's a mutual process. It requires a lot of responsiveness and reciprocity. So, if you find that there is a situation where one partner is unwilling, you have two options. Either you shift to an individual mode, or you refer them to an individual therapist each, where the focus would be for the partner who is willing to keep working on understanding what role they play within the, how does it contribute to the challenges that they're experiencing and what can they do differently. And for the partner who is unwilling to continue, the focus would be on first building the motivation and to understand how marital therapy can be helpful to resolve whatever questions or concerns they may have. Sometimes the person who is not interested may not want to go to another therapist and may benefit from just having one or two interactions with the marital therapist itself for the same. If there is a resolution on this aspect, then marital therapy can be engaged in. Um, no, we don't have an assignment. explain the existence of marital therapy in the context of narcissistic personality disorder. There is nothing specific with regard to the same. If there is a clinical diagnosis, or if there is a particular personality constellation, you just need to keep that or take that into account or factor that in when you're working with the couple, and understand what the complicating factors or the dynamics tend to be able to ensure that when you're conducting your interventions, you're able to be more effective in the same. What if the female is coming to seek help but the male is not? It's the same situation. If the male is not or the female is not, you try and work with the partner who is coming to be able to at least support them to better their relationship or to achieve whatever goal it is that they're approaching you for. You may also be able to share with them what is it that they can communicate or share with their partner that may be able to help them understand what couples therapy can do for them and how it may be beneficial. And that would be something that would be helpful. Can a couple counseling sessions of counselor be used for legal issues? I'm not sure what the question means. You may need to elaborate on that. What if the couple becomes dependent on the therapist to solve issues every time? Like I was sharing, that see, the goal in couples therapy is to ensure that the couples tend to develop the right skills to be able to take care of the challenges that they are experiencing within their relationship with each other. The therapist is not there to take on the decision making role within their relationship, because if the therapist starts doing the same, it would lead to a dilution of uh, the kind of equation that the couple have with each other, and it does not enable them to be able to function more effectively with each other. In an ideal scenario, what is extremely important is to keep on working towards helping the couple better their understanding of the problems that are happening, where they're coming from or emerging from, and how is it that they can take care of the same. And you help them build the skills to be able to communicate better, solve for problems, understand the ways in which they can function more effectively. If there is a disagreement, there is a way to be able to resolve the same. Everyone is asking that there is no assignment today. No, there is no assignment today. We are not going to be doing an assignment. This is a session where you just need to hear, understand, build an understanding, and hold on to that understanding, and see if this is an area that interests you to be able to read more and understand more. Marital therapy is a very, very, very large area. What I've covered today is not even the tip of the iceberg. And if you were to delve into the depths of even each of the approaches that I did talk about, you would realize that there is much that you would need to read, understand, learn, and hold on to. So that is something that would be helpful to you in the long run if you were to choose to work with couples in the future as well. So yes, so no assignment today. Please do ensure that you fill up the attendance sheet. That is something which is more crucial for this session today. We will be having assignments for the subsequent sessions. In the context of any special populations that you may be working within marital therapy, I think it's important to understand that at the end of the day, people are people, and people would have their own unique individual self that they will bring to the therapeutic situation. And when they are coming in with their own individual experiences based on whichever community they come from, understanding what has affected them, what has impacted them, how do they see themselves, how is it that it has shaped their understanding of relationships, and the ways in which they function in relationships becomes extremely crucial. So those who come from marginalized communities, whatever those communities may be, it becomes extremely important to build a more comprehensive understanding, because you may not belong to the same. And because you don't necessarily belong to the same, uh, having that more comprehensive understanding would be able to ensure that you are able to build a greater empathetic connection with the individuals who are there in front of you. In fact, if you were to read more about multicultural therapy, whether in the context of individuals or couples, this is what they emphasize, that experiences of people coming from different communities can be extremely different. And it is important to focus on building a more comprehensive understanding, recognizing that whatever your derived knowledge is of how things function may not be applicable in that context. And you need to be open as a therapist to reviewing what frame you are coming in with. While the techniques and goals or ways of working may be the same or similar, you may still need to have openness to be able to embrace or build a better understanding of what experientially things have been like for the couple if they're coming from a marginalized community. So yes, there is no assignment, lots of questions around that. um, well, I can tell you that if you want to read more about marital therapy, there are actually a lot of different books. There are handbooks of marital therapy. You could start over there. Depending upon which specific school you prefer, then you may want to pick up books which are by the originators of those therapeutic intervention models. So, if you like EFT, uh, go to the books written by the author. If you like Gottman's therapy, then go to the Sound Marital House book, which was written by, or the Marriage Clinic, which was by Gottman. If you want to read overall about marital therapy, then there are the handbooks. One of them is by Gurman, and there are some others as well, which you could look at. So lots of books which you may be able to refer. Can we provide therapy sessions to couples in our family? It is best to not work with either individually or in a couples framework with those who you know very closely, because you would already have certain preconceived ideas and notions about them and about what their relationship may be like, and that could influence the work that you do, because you may not adequately seek information and to be able to fully understand what may be happening. So that can compromise how you tend to implement your intervention, and the as a result the overall effectiveness of the intervention as well. And if this is a close relationship, or not even a very close relationship but even somewhat distant, if things don't work out well, it would also spoil your personal equation with them. It is ideal that you refer them outside to someone else. What if one partner is abusive and they are not able to change their actions? What should the therapist do? See, it is important to also understand and evaluate that if there is aggression which is coming into the situation, where is that aggression coming from? Is that a constellation of something which could be clinically otherwise significant? And would this individual need to work on it individually with a therapist and not just within the context of the couple's modality? And it would also be important to understand that does this aggression reflect in other parts of their life as well? So, so that would be extremely important. So, for instance, if they also have, say, road rage, in meetings they get angry, it could be an overall challenge, and that may be something that they would need to look at differently. If this is only within the context of the marriage, then it would be important to understand what is it that is allowing them to keep on engaging in that action over there, and that may still require some individual work. So, based on that whole understanding, you may have to take an approach which could be helpful in mediating the entire situation. There are some specializations which are available for marital therapy, which you can look at, some short courses which are there, mostly based outside the country, I believe some also within the country. It is better to do some amount of specialization within this field, and not just look at having your current degrees, whether they're masters or MPhils, as adequate, because working with couples is very different. My suggestion would be to not just to read it extensively, of course, but also take some additional training, and if possible, also some amount of supervision, peer mentorship, guidance, whatever it is that would work best for you. Okay, so thank you so much for being a part of the session today. I hope it was able to help you build a better understanding of what marital therapy is like and how it can be utilized with couples. And please do join us for the next 3 interactions. And my colleagues will be here and they would take care of the same. So thank you so much, and we would see you tomorrow, 3 o'clock. My colleague Divya Jain is going to be here, and she would be talking about sports psychology, and that would be a very very interesting session. So do make sure that you join in. I think Divya would have an assignment as well, so you don't have to worry about that. But yes, reiterating once again that today there was no assignment, so please don't worry about that. Just ensure that you do fill in the attendance sheet that is adequate for today. So have a good day and thank you so much.